Hello, my name's Emma Gordon. I am 40 years old. I'm the person who will see you for your prostate cancer, for your kidney stones. I've been training for the last 5 years. I have another 3.5 years to go.
Hi, I'm Roshana. I'm a junior doctor. I look after you if you've had a car crash and broken your bones.
I started medical school in 2001 and I became a junior doctor in 2006. I'm still a junior doctor. I'm 32 years old and I've still got 5 more years of training to go.
Hi, my name is Poonam. I'm a plastic surgery trainee. It's taken me 5 years of medical school and 4 years of training to get to where I am.
My name's Ranchling and I'm a junior doctor. I've been a junior doctor for almost 13 years now. I'm 36 and I think a lot of people wouldn't realise that actually I'm still classed as a junior doctor.
This is what it's taken me to work in the NHS as an obstetrics and gynecology doctor.
The NHS needs more doctors and more nurses and more funding, not devalue the staff that we already have, force them to work more on social hours for less pay. It's not fair and it's not safe for our patients.
By removing the safeguarding to limit the amount of hours we work, we kind of go back to the old days in which you speak to senior colleagues. They used to work 100-hour weeks and it really compromises patient safety. You wouldn't want a pilot operating a flight if he's overworked and tired working 90-hour weeks, so why would you want your doctor?
And now it's just going backwards, and I'm really worried about the safety of all of the patients and of the doctors themselves.
We've got staffing that's short, we're at crisis point, and comes another demoralising contract that's going to make more people take the final step and actually have to leave because they can't afford to practice as doctors anymore in this country.
We're really worried about our futures, and we're worried about our patients' futures, and we're worried about our families' futures.
I'm worried. 5 of my SHOs have already gone to Australia, and I know another 5 are thinking about it.
Yeah.
And I'm thinking, next year when I'm on call over a weekend, where are the other junior doctors going to be coming from? Because they're not going to be in the country anymore.
I want to make sure that the NHS is kept safe for my patients and the future generations. And I want to make sure that there's a fair contract for junior doctors.
The fact is that tired doctors are unsafe and overworked doctors are unsafe, and we need a contract that values young doctors.
Junior doctors will strike! We will strike to prevent the dismantlement of the NHS! We cannot let this happen! We must not let this happen! And we will not let this happen!
Less doctors, longer waiting times, and less staffing levels across the board, not just during the weekends, but across the entire week as well.
I know quite a few colleagues will leave the NHS, and their talent will be lost.
If these unsafe plans progress forward, I might choose to go back to where I came from, which would be New Zealand. And I think a lot of other doctors are thinking the exact same thing.
Do you want a fresh, alert, rested doctor looking after your mum and dad, or do you want someone who's on their knees and exhausted and stressed? Because actually that's what we're going to end up being if this contract goes through.
I'm Sarah and I'm here today as a member of the public. If doctors are working longer hours, it's not safe for patients, and as someone who's got a long-term health condition, that directly affects me and it affects the quality of care I receive. It's not the fault of doctors, that's the fault of the new contracts and the way that they'll be implemented by NHS trusts.